everyone, and welcome to Why Psychiatry, where we hear from our NEI Max faculty about their personal path to psychiatry. I'm your host, Dr. Debbie Ann Morissette, Director of Content Live Events at the Neuroscience Education Institute. Today we have a very special guest, Deb York. So welcome, Deb, and thanks for joining us today. We are super excited to have you speak at NEI Max and to have you here with us today. And what we want to know is we want to know about your journey to get into psychiatry and how that came to be and learn a little bit more about you. So can you tell us about your journey and why psychiatry?
Okay, well, thank you, Debbie, so much. I'm honored to be a faculty member at NEI. I have a vast journey of nursing and fortunate for my extraordinary mentors, friends, and colleagues along the way, or else I wouldn't be here right now. So I started off in life with a medical family. I'm the middle child between two brothers. And my mother actually is a nurse. My father is a neurophysiologist. And I grew up in his neurophysiology lab. And I think the draw immediately, of course, were the animals to a small child. He had monkeys and rats and mice and rabbits. And I developed this indefatigable curiosity for science in the brain at a very young age. And neuroscience going through undergraduate was not my favorite subject in school. There was way too much to memorize and it was overwhelming. But the neurochemistry in the brain remains a serious challenge, as you know. And there is so much that we do now know about the circuits and networks in the brain, and yet still so much more to learn. And that's the fun part, to figure out medications now that we have some objective data with pharmacokinetics. And so as far as my path into psychiatry, when I was 12, I was actually in a really traumatic car accident and spent a long time in the intensive care unit with extensive abdominal surgery. And my nurse, Cody, brought me through every day. And through that experience, there was no question that I wanted to be a nurse and to pay it forward to someone else like he did for me. And in retrospect, I would also like to share that I was a depressed teenager following that accident and recovering from that accident. And it was a serious, adverse childhood experience. So later I went to nursing school in St. Louis, and I worked in the burn trauma ICU. It's a class 1 trauma facility, and invited to work with a leading pulmonologist and became the septic shock ARDS clinical research coordinator in the ICU at Washington University. And at that point, I was also working in the animal lab. And after figuring out finally that research was my passion, I worked as a clinical research associate, monitoring clinical research data for multiple pharmaceutical companies for about 25 years, and then opened my own research facility specializing in women's health. Then I went back to graduate school and got a master's in women's health, nurse midwifery. And my road to psychiatry was met when a partner near and dear to me had a chronic traumatic brain injury from playing football back in the 80s when they were much less protected. In addition, I had a 36-year-old pregnant woman with no prenatal care who popped into my office one day on methadone. I didn't even know what methadone was. And my curiosity of mental illness was spreading like wildfire. So I went back to school and completed my master's in psych mental health and used my women's health degree to specialize in endocrine psychiatry and how mental illnesses relate to hormone imbalances. And also inclusive of traumatic brain injury, the key neurosteroid hormones needed for recovery in that disease process as well. So what drives me every day in this field is making patients better, making a difference, paying it forward, continuing to be curious as a lifelong learner. And as clinicians in this field, we have to have this understanding of disease burden and illness in a broader context in psychiatry. And I love this part of the puzzle. It includes the epigenetics, the neurobiological consequences of early life stressors, resiliency models play a huge role. And the science of the mind and brain is multidimensional and very complex. And that's what makes it like the fine art to treat, per se. And it makes it fun.
Awesome. It sounds like an incredible path. And it sounds like you got your inspiration from your own personal experiences. And thank you so much for sharing that with all of us. And I do have another question for you. You're giving several talks in your big debut, which we're very excited about. And not only as part of the Cannabis Academy or workshop that we've got going on as a pre-conference event, but you're also giving two really powerful talks, one on early life adversity and the other on intimate partner violence. And so I'm wondering, do you have a favorite among the talks that you're giving that you're, especially excited about that you want to share with us?
It's a great question, and it's a difficult question, but I'll be super vulnerable right now and tell you that I actually did not know about this until one of the NEI writers, PhD writer Sabrina Siegel, brought this to my attention, and it's traumatic brain injury and intimate partner violence. And it was introduced to me by Sabrina and her work at Arizona State University. And the statistics really are staggering. And as a clinician who specializes in traumatic brain injury, I was completely unaware of this forgotten population. In the United States, an average of 20 people experience intimate partner violence every minute, which equates to more than 10 million abuse victims annually. And imagine these statistics were before COVID-19 entered our planet. And I cannot imagine the impact this virus has played to increase these numbers, including children worldwide. As many as 75% of women who experience intimate partner violence had at least one partner-related traumatic brain injury, and 50% had multiple. So it's this population we forget to even think about as possibly why they're depressed or anxious, or are they really bipolar, or have they been hit in the head too many times? And at NEI Max, I'm going to present how to screen and rule out traumatic brain injury in this vulnerable population.
Yeah, it's gonna be awesome. I really do think that, and definitely Dr. Siegel totally, introduced us to this idea, and she's done a lot of research on the topic. It turns out when we think traumatic brain injury, we tend to think of football players and boxers and military members. And, you don't think about somebody that's been involved with intimate personal violence. And, but when you actually stop and you think about it, they are most likely enduring a lot of brain injuries and impacts to the head, and they don't have helmets. So, it's incredibly important. And as you mentioned, with COVID-19 and the isolation we've all been going through, I know that there definitely is speculation that intimate personal violence and early life adversity may be, increased during this time. So you're giving two, like I said, really powerful and very important talks. And I think our audience is in for a real treat, and definitely really looking forward to seeing you up on that stage.
Oh, well, thank you. I would really like to end with gratitude, Debbie, for you, excuse me, and all the NEI staff and faculty who work tirelessly to form amazing education in the neuroscience world and psychiatry. And really, if we wake up with gratitude every morning, just to be thankful for each other and the beauty around us, our bodies, our health, friends, food, family, and so much more, then it, during this time of COVID and this isolation, it gives you just some little piece of hope that soon this will end, and all pandemics do end, believe it or not. So I think if we keep that in mind each day, that will help people definitely have a sense of hopefulness instead of all the hopelessness that we see so much in our patient population. So thank you so much for having me today.
Thank you so much for joining us today and sharing your very personal journey and experiences and letting us, get a little insight into Deb York and how you got to be where you are. And thank you so much.
Great. Thank you. And please, everybody, stay safe.